Good morning, folks. Ron Ray here with Turning 65 Solutions. We are in the middle of our 2025 update video series. So we're going back and just updating some of the videos that we've been doing for years, the videos that you know and love. And if you're new to our channel, thanks for being here. Be sure and hit the subscribe button down below. And later, when you're done watching the video, if you enjoyed it, be sure and give us a thumbs up. That helps YouTube get this video out to other people or had the same questions that you were today. Today, we're going to talk about something we haven't really covered in a long time, and that's just what exactly is Medicare Part C, also called Medicare Advantage. And so I'm going to take a little bit more time today and kind of teach you exactly how it is. All right. And if you know the channel, we always go to a great non-biased third-party source of information. We've got a great website to it, t65s.com. I'll show you that in a minute. Today, we're going right to the Medicare and You book, but we're going to go down. You can download this right from the Medicare website. You go to our website and get it there as well. But we're going to start right here on page 10. And just remind you that when you go into Medicare, when you're turning 65 and pretty much every year thereafter, you have a choice of how you obtain your services, either through original Medicare on this side or Medicare Advantage, also called Medicare Part C on this side. And folks, it's one or the other. You can't have both. And once you make that choice, depending on a couple of different factors, you might not be able to go back, or you at least might not be able to go back anytime you want. You might have to wait for a special enrollment period. So it's very important that you get educated, you do your homework. With original Medicare, this is where you keep original Medicare A and B, and then you add a Part D plan, that's prescription drugs. Part A is your hospital coverage. Part B is your outpatient coverage, doctor's office visits, outpatient procedures. Part D is your prescription drug coverage. Now, together, A and B cover roughly 80%, up to 80%. It can be more depending on the situation. Part A has different cost sharing for you than Part B. Part B is, $257 deductible this year, and then 20% after that. That's what you pay. Part A has different deductibles depending on when you go into the hospital and how long you're in the hospital. Part D is separate. You do not get prescription drugs through Part A and B. So they added in 2006, they added Part D. That's the prescription drug program. There's a whole bunch of those plans available. Everyone is a little bit different, and we don't know which one is the right one for you until we search the market for you based on the prescriptions that you take in your area, and then we can find the right one. Now, remembering that they only pay up to a maximum of 80%, you're going to need a supplemental coverage. We call this Medigap or Medicare Supplement. These are the letter plans, Plan N, Plan G, Plan F, Plan J, or A if you go way back. We're going to cover those in another video. In fact, we just updated some of those. So go back, look at the update videos for Plan G, Plan N, Plan F, high deductible G and F. They're all out there. They're brand new videos, and they're out there. You can look them up on our channel. We're going to talk about today, though, Medicare Advantage Part C. Now, Part C is different, right? You don't have Part A, Part B, Part D. Part C, what that does, just like the book says, right? This is the Medicare guide. It offers you an alternative to original Medicare. So what happens when you elect to go into Medicare Advantage or Medicare Part C? Medicare, the government, Part A and B, they say, we're out. And for that calendar year, they contract you out to this private insurance company that you choose. And then that insurance company becomes your primary insurance payer. They're your primary insurance. Now, you don't lose original Medicare. You're still in the system. But for that calendar year, they've said, here's the money, you take care of them. And you continue to pay the $185 for Medicare, $185 for Medicare Part B, but Medicare sends that money over to this private insurance company. They say, here's the money, you take care of them, okay? And for that calendar year, original Medicare, they're out. Now, you may be able to go back You can go back actually during this time of year. It's February right now. From January 1st to the end of March, you can go back during the open enrollment period. They call it open enrollment period. It used to be called the Medicare Advantage disenrollment period, when you could leave Medicare Advantage and go back. You can only do that once a year during this time frame that we're in right now. It's called open enrollment. Not to be confused with annual enrollment or annual election period that happens from October 15th to December 7th. That's when you can make changes to Advantage plans or prescription drug plans. So what Medicare Part C does, it takes the place. In fact, doctors' offices have a habit of calling it a Medicare replacement plan, because to them, that's what it is. It replaces original Medicare, at least for that year. It provides your hospital, your medical, your A and B, and usually Part D. Most plans have prescription drug coverage, but some don't. You have to be careful. And they combine all that into one convenient plan. Now, what you have to watch out for is, like Part D, like the prescription drug plans, everyone is a little bit different. Some have, and it's right here, some have drug coverage, some don't. Many cases, you're going to only be able to use the doctors that are in the plan's network. Now, if you have an HMO, it's very strict. You can only go to doctors that are in the network. If you go to a doctor that's not on the list, the plan is not paying anything. You're on the hook for the entire bill. PPOs are a little bit more open. They'll let you go to doctors that aren't on the list. You just pay more out-of-pocket costs. So if your primary care doctor in network is zero copay, so it's free to go see your primary care doctor if they're in network. If you go out of network on an HMO, they're not paying a penny. You're going to pay the full cost of that visit. If they're on a PPO that has a $0 in-network primary care visit copay, out of network might be something like $35 or $50 for the same thing that's just in network or out of network, right? So in most cases, you're going to have to go to doctors that are in the network. And in many cases, you need to get approval from your plan before it covers certain drugs or services. So now you have pre-authorizations called managed care. What are they managing? They're managing their cost. To be fair, these companies are in business to make a profit, and one of the ways they manage their cost is to say, no, we're not going to pay for that procedure. We want you to have this other cheaper procedure, and then we'll pay for it. That's called step therapy. But they also can just say, no, we don't think you need it. It's not to our benefit to pay for that. So the insurance company gets a say. Unlike supplemental coverage, Medigap, Medicare Supplement, these insurance companies, they don't have a say. If Medicare, original Medicare A or B approves it, the insurance company doesn't have a choice. They have to pay their share. But with Medicare Advantage, remember, original Medicare is out of the picture, so they get to call the shots, and everyone's a little bit different. So HMO plan over here from XYZ company might approve that knee injection you need, where PPO company ABC over here might say no. And we don't know which one's which until it's too late, because we don't have good access to that information. Now, we know from experience which plans are easier to work with than others, but these things pop up and you're not going to know about it until there's a problem. Right. They often have different out-of-pocket costs in original Medicare and Medigap, and may or may not have an additional premium. So that's what makes them quite attractive to a lot of people. So over here on original Medicare, you're going to pay $185 for Part B. You're going to pay somewhere between $0 and $80, $90 for Part D. Let's just call it $25 is probably about average for our clients. And your supplemental coverage is going to be somewhere around $100 to $150. We're in Central Texas, so our Medigap plans are pretty reasonable here, right around $120 for somebody turning 65 a month premium. But then you're very well covered. On Medicare Part C, you're only going to pay the $185, and then most of them do not have an additional premium. If they do, they're very low. It might be $20 or $40, but most are going to be $0. Where you will pay is when you go to the doctor. That's why we say they have different out-of-pocket costs. Go to the doctor, you might have a $20 copay. Go to the emergency room, you might have a $100 copay. Take an ambulance ride, $300. Spend the night in the hospital, $300 a night. Go get an MRI, that might be 20%. go get a heart surgery. You might pay 20% for that doctor or that anesthesiologist. Who knows? They do have a maximum, so an out-of-pocket cap. So original Medicare A and B, there's no maximum on the amount of money that you can pay out of your pocket. Medicare Advantage plans, number one, they have to pay at least as well as original Medicare. So they have to pay at least 80% in network. Out of network, they don't have to pay 80%. And they have to have an out-of-pocket max. Okay, so in our area, this varies greatly around the country, but in our area here in Central Texas, HMOs are going to have a lower out-of-pocket maximum because they're more restrictive on what you can do and who you can see, usually around $3,000 or $4,000 a year. PPOs are going to be higher because they're open. They're going to have higher out-of-pocket maximums, somewhere around $6,000 or $7,000 a year, and that's per calendar year. So guess what? You get sick in December. Let's say, worst case, you get cancer. You get diagnosed with cancer in November. You go get your radiation and chemotherapy in December. You're going to pay $7,000 for that service. And then guess what? You go back for your next treatment in January, $7,000 again. Okay. So it's a maximum per calendar year, not per 12 months or policy year. And so that's the big hazard, is that out-of-pocket max. Now, not many people, statistically around the country hit that out-of-pocket max, but when it happens, it happens. The quickest ways to get there are cancer or an extended hospital stay. And if there's one of those you're concerned about, we can usually get you a hospital indemnity plan or a cancer indemnity plan that will ride alongside of your Medicare Advantage plan and cover those costs for you. So we can still get you covered and still usually save you some money. Now, most of them, but not all, cover Part D. So they include the prescription drug coverage in them. The way the prescription drug coverage is much like the way the prescription drug coverage works on this side. You go to the pharmacy, you might have a deductible, you might not, but you're going to have copays. Some of your generic drugs are going to be free. They're not going to cost anything, but your brand name drugs, your specialty drugs, your tier 3, 4, and 5 drugs, they're going to cost money, and they can be quite expensive. So we have to do some good research right here on this part. We have to research doctors and hospitals that you go to make sure that they're in your network and you could actually go and see your doctors. And then we have to research down here to make sure your drugs are all on the list and they're not going to cost you more than you can afford. Now, the other thing that Medicare Advantage plans have going for them is they provide some extra benefits that Medicare doesn't cover, like dental. Original Medicare does not cover dental, does not cover vision, doesn't cover glasses and contacts. They provide some other benefits beyond dental and vision. They might provide a health club membership. So if you've ever heard your friends talking about silver sneakers, well, that's what that is. Or they go to the gym for free. That's included in most of these plans. Not all of them have them. They might provide some over-the-counter reimbursement or over-the-counter allowance. They send you a little debit card, and once a month or once a quarter, they put some money on that card for you to go to the pharmacy and buy your over-the-counter stuff like, I don't know, like Tylenol or vitamins or allergy medicine. And that's a nice little perk. Some of them might provide even more allowances for things like healthy foods. If you're on a plan that's a specialty plan for diabetics, it might give you $100 a month for healthy food because they want to keep you healthy. So there's some other things that go along with Medicare Advantage. So as long as you're willing, you understand the risks with that out-of-pocket and with the network and managed care issues, and you're willing to take that risk in order to get those extra benefits and the lower upfront cost, Medicare Advantage might be right for you. So I always say that these two sides represent two different approaches. Original Medicare with the supplement represents freedom and predictability because you can go to any doctor, any hospital that you choose, as long as they accept original Medicare. The insurance company has no say. And when you go, you know exactly what your out-of-pocket cost is going to be for the year because your supplement's going to pay most of it. So if you have a Plan G Medigap or Plan G Medicare supplement, your out-of-pocket cost or out-of-pocket max for a year is going to be $257 this year. It's just the Part B deductible, and that's it. After that, you pay zero for the rest of the year. So Original Medicare with a supplement represents freedom and predictability, where Medicare Advantage represents budget and benefits. The upfront cost, the monthly cost is going to be lower, and they're going to provide some of those extra benefits that you don't get on the original Medicare side. But it's a trade-off, right? There's no such thing as a free lunch. So you're going to take on some out-of-pocket risks. Now, it's a risk. It's not real unless it happens. Like, you don't pay that $7,000 out-of-pocket max unless something bad happens. But when you do, you just have to make sure you have a plan for that. So that's Medicare Advantage. Kind of compared the two sides. You have an opportunity to choose this when you're turning 65. And then every year after that, if you choose Medicare Advantage, you can go back during what we're in right now, the open enrollment period from January 1st to the end of March. The catch is you can always go back to original Medicare A and B, but you have to be healthy enough to get a Medicare supplement. See, because by that time, you're not in this open enrollment period or initial enrollment period for Medicare supplements. And now you're subject to medical underwriting. You have to answer a series of health questions, and the insurance company can decline you based on your answers to those questions. So that's why I say it's very important to make a wise, well-informed decision now. When you turn 65 and you've got the opportunity to do whatever you want with no health questions asked. Now, we don't care. We do both sides, okay? We don't care which one you choose as long as it's right for you. So when you come to see us or when you give us a call, we're going to have a good long conversation about your health and about a few other things. And then we're going to make the best recommendation for you based on your specific needs. We're going to lay out a couple of different options, and we're going to let you choose what makes the most sense to you. So we're just educators. We're not salesmen. We're not salespeople. We just educate you, give you your options, and make sure you are making a well-informed decision. And that's it today, folks. If you have any questions about this or need any help or have any concerns or at all, or just give us a call at 830-217-6711 or reach out to us on the web at www.t65s.com. We've got a great website. It's got lots of answers, lots of free information. We hope to see you again soon, and we hope you have a great day. Bye, folks.